Hello, my name is Angela Hilliard. I am a senior at Santa Fe High School in Alachua, Florida, and this is my few response to this year's Brain Bee question. A former NFL player has been diagnosed with traumatic encephalopathy syndrome, which is a clinical form of chronic encephalopathy syndrome, as CTE can only be diagnosed at autopsy. This presentation will cover what, why, how of these disorders, as well as the similarities and differences they have with Alzheimer's disease, and the impact of neurodegenerative disorders on certain regions of the brain. To begin to even briefly describe the abnormal pathology of CTE, one should start with the protein tau, or microtubule-associated protein tau. Microtubules are small little tubes in the brain that help facilitate movement through the axon as well as axonal structure. Although the exact mechanism is not known, CTE is known to cause disruption to these microtubules from repetitive mild brain traumas, allowing the tau to go freely into the cell, where it becomes hyperphosphorylated and thus misfolds. Misfolded proteins have a prion-like mechanism that causes other healthy proteins in the cell to misfold as well. Since the microtubules are not being supplied with their needed protein, the cell will die from not being able to support itself. These tau misfolds have properties that allow it to aggregate together into paired helical filaments, which then further aggregate into neurofibrillary tangles. These tangles can be identified with post-mortem neuropathological analysis using immunostaining techniques that allow pathologists to literally see these hyperconcentrated areas of tau in the brain. This is really important because no other neurodegenerative disease has these specific concentrations, even others that have tau concentrations such as Alzheimer's. So if Alzheimer's and CTE are both related to tau, what makes them different? Well, if you remember, CTE is not something that we're going to diagnose while a patient is still alive. But we can diagnose TES, and there are actual diagnostic criteria that are new to the medical scene, but have been agreed upon by many neurologists. Some similarities between them is that they're both neurodegenerative disorders with eventual widespread atrophy of the brain. They can present with memory loss and behavioral changes similar to other dementias, and that they're progressive over time. There are key differences, though. Early TES symptoms appear younger than Alzheimer's, usually in the 40s, but they can appear as young as the 20s. And there are more neurobehavioral changes, such as uncharacteristic aggression, poor impulse control, and poor judgment, and it mostly involves only tau. In Alzheimer's, you're going to have later onset with mostly geriatric patients, and they're going to experience changes in the cognitive areas upon early symptoms, such as memory loss and confusion. And the protein beta amylase has been indicated in Alzheimer's and not in TES. Just wanted to look at this diagram quickly. That kind of explains the early onset symptoms a bit visually. So you see here that in TES that we're going to start with the frontal superior gyrus, where you're going to have impulse control and higher reasoning, and over time move over to the temporal lobe with memory. But conversely, in Alzheimer's, you're starting in the temporal lobe, in the entorhinal cortex with the hippocampus, where we're going to have memory, and only later are you going to move on to the prefrontal cortex, where we're going to have personality changes. We talked about some differences, now we're back to some similarities. So there is no test for Alzheimer's or TES. There are cognitive examinations and taking patient history and tests to rule out other conditions, such as a tumor or a vitamin deficiency, but you're not going to test for either of these conditions. What's most important in the clinical presentation is context for diagnosis. If you have a geriatric patient, it's more likely to be Alzheimer's if they're experiencing memory loss, as Alzheimer's is a very common disorder for those over 65. But TES, if your patient has said that they had a history of contact sports playing and military service, and they're coming to you in their younger years, in their 20s, 40s, 50s, then you're going to suspect that maybe there's something up. Hippocampal damage has been known to result in issues in encoding new memories, the loss of understanding of the context of old memories, as well as spatial disorientation. If a patient were to come in with just this, it would be more likely to be a symptom of Alzheimer's, as if the patient had CTE and degeneration of their hippocampus, it's most likely that their frontal lobe would also experience degeneration as well, due to the progression of both of these disorders.